Welcome back, friends. Today, a very serious topic: strokes. There is often no dramatic warning, no immediate pain. Instead, it starts quietly. Subtle changes, small irregularities, which is exactly why strokes are so often missed. And during those critical first moments, time becomes the most important factor, because the brain does not wait. With every passing minute, millions of brain cells begin to suffer damage that cannot be reversed. But there is something extremely important that everyone should understand: a narrow window of opportunity, a period in which rapid action can dramatically change the outcome. For many strokes, this window lasts approximately 3 hours. 3 hours to protect the brain. 3 hours to prevent permanent loss of speech, mobility, and independence. And yet, many people lose that opportunity for one simple reason: they do not recognize what is happening. Let us change that. There is a simple recognition method used worldwide. 4 letters. It's called FAST. Let us go through it calmly and clearly. F. Face. Ask the person to smile. If one side of the face appears uneven or begins to droop, this may indicate a stroke. A. Arms. Ask them to raise both arms. If one arm drifts downward or cannot be lifted properly, this is a serious warning sign. S. Speech. Ask them to repeat a simple sentence. For example, "The sky is blue." Confused, or if speech becomes slurred, difficult to produce, this is a medical emergency. T. Time. If you observe even one of these signs, contact emergency services immediately, not later, immediately, because strokes are extremely time-sensitive, and there are critical mistakes that must be avoided. Do not offer food or water. Do not give medication. Do not attempt to drive the person yourself. Paramedics can begin treatment while en route to the hospital, saving valuable time. While FAST is highly effective, some strokes present differently. Pay close attention to sudden symptoms such as a severe headache, unexpected vision problems, loss of balance, sudden confusion. Even if these symptoms appear briefly and then seem to improve, they must never be ignored. This may indicate a TIA, often called a mini-stroke, and a TIA is not harmless. It is a warning. Many major strokes are preceded by temporary symptoms that were dismissed. Now let us discuss prevention, because the majority of strokes are linked to manageable risk factors. The most significant is high blood pressure, often called the silent killer, because it produces no pain, no obvious warning, yet greatly increases stroke risk. Managing blood pressure is one of the most powerful protective steps you can take. Other major risk factors include smoking and diabetes, lifestyle-related health conditions. But prevention is possible at any age. Small, consistent adjustments can lead to meaningful improvements. Finally, preparation. Discuss FAST with your family. Keep emergency numbers accessible. Store medical information where it can be quickly found. Review this knowledge periodically, because during a real emergency, recognition must be calm, automatic, and immediate. Remember, FAST. 4 letters that may one day save a life. What we discussed today may help you recognize a stroke, but recognition is only part of the story, because many strokes are preceded by a silent warning sign, one that most people overlook. Make sure to watch the next video. Subscribe for more essential health awareness videos. Thank you for being here with us at Senior Souls. If you found this information valuable, consider sharing it with someone you care about.